How are you doing?
Good.
I met your sister.
I'm sorry.
Hey, come here a second, Karen.
Again,
I was in the locker room at the Y.
Sorry.
oh, no, my
I thought you
sister-in-law.
were mad at me.
Sister-in-law.
Yeah,
Why would I be mad?
that's Linda's sister.
Maybe because I came down to what I thought that they were. Listen, Jersey Shore, did you see that?
It was time for a
Yes.
change.
The Jersey Shore, everybody in there
To call you a
has
lawyer.
gotten over the.
Yeah, they're lies, Gretchen, they're lies.
Are you throwing things away?
Yeah.
They now have a second site, Gretchen, and Sunbury,
Yeah.
Third in.
33 of 33, I believe.
And how many staff? It was like in the teens.
Yeah.
And
No,
I think
more.
they were doing the testing down there.
Yeah, she goes there every 2 years.
They're in section.
How are you?
Very good.
Well, North Cumberland Cops have been known for.
True, very true.
She
I
goes
do
to
identify with
I'm from
Gretchen.
Danville, so I ought to.
You're allowed to say that?
What do you mean I have to say that? Hey, at least we keep ours locked up.
Hey, this the Ohio County North Cumberland County Commissioners, that's
Yeah.
really your
Driving by the
right.
gym now, so that's.
To talk to them about a similar plan?
And the other thing
That's-
is,
I just avoid
Department of Health for
driving
North Cumberland County called me yesterday.
I looked online and saw it, but I did not see it.
and the
Good.
Oh, yeah, I heard about people doing that. Yeah, I know.
It's not quick for your back.
Here it is, the last page. Page 811.
That's bothersome, we can do something.
No, I didn't. I thought it was on the agenda for today. I figured we were voting on it today. Okay. Well, then,
The item number to do it sooner.
Who's this guy? Oh, he's our.
okay, so it's on.
He's the administration director.
Oh, yeah, he's the one that was shooting down, but it's my comments the other week. So I'm sure he'll have a real-
Exactly. Get out there and say your thing, right?
Yeah, but we're going to Northumberland, so we have to just
I'm the shooting
their
commissioner.
commissioners.
With them. I can't go.
I know you can, I'm just telling you what we're up to.
You don't have a fully charged battery on that
We're
thing,
gonna
Gretchen?
supercharge
Hey,
that.
this has a lawnmower battery.
Goes for a
It's a
long.
special one. It's brand new this year.
We'll supercharge it.
Supercharged it.
Maybe we can ask the commissioners for help.
Thank you.
How are you?
I'm fine. How are you?
Good.
Thank you.
For what?
Yep.
Oh.
No! Put it on.
No, I can't put it on.
Put it, if everybody else has to wear one, why are you better?
I don't have to wear one.
Hey Gretchen, you know what I find very uncomfortable? Pants. But I still put them on when I go out in public to protect other people.
Is the zipper in the front or the back?
No, my point is that pants are no more damn comfortable than a mask, but I still wear them.
Oh, God. Hey, Mary Jo sent you a message.
Greetings from the wall.
You dog. Did you catch any fish?
I caught more than Bill.
Did you really? What'd you get, Ben?
No, one bass, but the walleye was biting like crazy.
Oh, I heard they were dancing.
Now, the
funny how they
walleye,
have
they
all
gotta be
this
15 inches to keep them, so we didn't get any big enough for keeping them. We
I
had
had,
12s,
when I
14s.
had my house, I had to wash the meat with your arms now.
Jay?
He was at the measuring on my wall.
Well, that was a muskie I got on my wall. I tell me about it. Everybody was scared when they get it.
Matt, how many addresses were listed? 13 addresses. Listed as positive.
When you do the 30-day one.
Thank you. Thank you. Thank you.
Okay.
One and two now. One with the information, one with the follow-up.
Isn't it amazing how government can work if it chooses to?
No, I'm not.
Are you gonna promote it as using the county monies,
Same thing we're doing here. Oh, for today?
Yeah, people know for November, are you gonna just straight funds that they have?
The street funds. Yeah.
Nothing to suggest where, yeah, gotcha.
Unless they want to sit down and have to work.
Okay. This is how we can have it. Gotcha.
Yeah, we got everything, because we're just, we got on the agenda.
Oh, okay.
Everything.
Vote on.
Yeah, yeah. Good morning. Ask you to please rise for our opening prayer and pledge of allegiance. Dear Heavenly Father, we thank you for this day that you have granted us life. We thank you for our glorious valley that we call home with its seasons that we can enjoy your creation. Lord, we continue to pray for the health and safety for our residents in our country. Continue to witness evil and unrest every day in our society. We know you are in control and will bring judgment. Father, we pray for the safety of our law enforcement and first responders. We know they are the line between lawlessness and unrest. We also pray for equality. We are all equal in your eyes. So we pray that our lives reflect and honor that equality. Lord, we just celebrated Father's Day. We thank you for the fathers that have been blessed with this gift. It's an honor and privilege to be blessed with a child. We ask our fathers to be good role models and a solid foundation for their children. Lastly, Father, we thank you for adopting us as your children and the gift of you as our Heavenly Father. We know that you never fail us and will guide us. Today we ask for your wisdom as we gather in this meeting. Give us clarity on the issues we're about to discuss. We ask you these things in your name. Amen.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Prayer people.
Good morning. We'll convene the Commissioners' meeting at this time and ask for the approval of the minutes of the previous meeting.
I'll move to approve. I'll second.
All in favor, say aye. Aye. At this time, we'll have public comment on agenda items only. Hearing none? Oh, I'm sorry. Go ahead, sir.
Hello, my name is Tima Cummings.
Hang on one second, we're gonna get to the microphone here.
Hello, my name is Tima Cummings. I'm a resident in Williamsport, and I use attendant care services, and am about one step away from a nursing home if I don't receive those services. We were wondering if you would be able to talk about item 811 sooner, as we have other meetings to attend.
And unfortunately, sir, this is where we have it on the agenda. We're gonna place it, we're gonna keep it there on the agenda at that location.
Okay.
Okay?
Chairman, I really don't have an issue with moving it up, but I don't know if we want people to come.
Yeah, I mean, we obviously have moved things all the time on the agenda to accommodate
I
people.
don't know if you can, but if you can, then I don't know.
Okay, hearing none, no objection, won't move it. Okay?
Thank you.
Okay. Want to jump?
We do our bid openings first?
Let's do the bid openings, and when we get down to the,
There's someone in the back here, Commissioner Jacqueline.
Yeah,
Yes.
there's another on public comment, on the agenda item.
are you on the agenda item, sir?
Yes.
Yes. You can come up to the podium, please, and announce who you are. Thank you, sir.
My name is Craig Allen. I'm a resident of Watson Township in Jersey Shore. I'd also like to talk about agenda item 811.
Okay.
My mother-in-law is a resident at Manor Care. And when all this discussion started coming up about taking residents from Manor Care and putting them at hotels and other things, we specifically asked her what she would like to do, because it was intriguing. Frankly, she said no. She's one of them who was tested negative throughout this whole event, and she's thankful for the care that she's received while she's at Manor Care. And I think people need to understand how and why this disease spreads. It doesn't have any precursors that say you walk in one day and all of a sudden you're infectious the day before you weren't. So I look at her experience at Manor Care as, you know, it's as simple as one employee, one visitor, one vendor coming into the facility, not knowing they were infected. And it spreads throughout everybody before it really is identified as being a problem. And once it's there, it's going to go to that vulnerable population. But at any rate, I would prefer that and my mother-in-law would prefer that $250,000 being proposed and relocating those people be spent for other services in the community. You could spend it directly perhaps on those residents at Manor Care, testing which ones were positive for the antibody to COVID rather than the antigen to COVID. And you would identify which members of the community, not just at Manor Care, but at other nursing facilities as well, that were at risk and which ones weren't. So you could direct your preventive care toward those that are still at risk.
Okay. Thank you, sir. Any other public comment regarding agenda items only? Okay. We'll move on to the bid openings first.
That would be 2.0 with Nikki Gottschall.
We have a bid opening for the Lycoming County Multi-Hazard Mitigation Plan update. We received 3 bids. The first one's from MCM Consulting Group. And their total price is $59,320.
Would you repeat?
It's an RFP.
Would you repeat that price?
Yeah, $59,320. Our next one we received from Tetra Tech. And their price is $49,500. And our last one is from Michael Baker International. That's $56,688.54.
Okay, thank you.
Can we move to 3.0?
Yes.
Okay. 3.0, accounts payable cash requirements report with Krista, or Nikki Gottschall, sorry.
Good morning, Commissioners. The cash requirement report was 1.19 million this time. Were there any questions about it?
I have none.
No, I have none. Just to note that the Lycoming County Visitor Bureau money is down to $32,642 for the month of April. And that shows the downturn in tourism in the county.
I have a motion to accept.
I'll move to approve the cash requirement report.
I'll second the motion.
All in favor, say aye.
Aye.
Aye, so carried.
Thank you.
Thank you.
4.0, team actions with Roxanne Greco.
Morning, Roxanne. Yeah, move that over so we can see you. Thank you.
Good morning, Commissioners. We're asking for an update to the TDA, a reclassification of one maintenance 1 position to a maintenance 3 position at a pay grade 7-8, and this to be effective June 28, 2020. Also, the removal of one part-time Veterans Affairs assistant position, pay grade 7, and this to be effective June 13, 2020.
Any discussion?
I'll move.
Okay.
I'll second.
All in favor, say aye.
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 So carried.
Moving on to personnel actions. At the prison, Josh Hewlett as a full-time replacement correctional officer relief, pay grade CO1, hourly rate of $17.23, and this to be effective June 29, 2020. In the courts, Patricia Kondo as a part-time tip staff, pay grade 1, $10.08 an hour, not to exceed 1,000 hours annually, effective June 29, 2020. In maintenance, Andrew S. Soboleski as a full-time reclassification for maintenance 3, pay grade 7, $18.08 an hour, effective June 28, 20. Finally, in the Sheriff's Office, Carl J. Finnerty as a full-time replacement deputy sheriff, pay grade DS, salary for an hourly rate of $18.34, effective July 6, 2020.
Okay, so these are all replacement positions, and
Correct.
I noticed here that the sheriff hired, was going to hire Mr. Finnerty, who used to be the chief of police in South Williamsport, who comes to us with outstanding credentials, all the training. The county doesn't have to pay for additional training to send him to the academy, so that's a cost reduction for the county also. And these are all good hires.
Do we have a motion? No.
No.
No, I'll move to approve the personnel actions.
I'll second that motion.
All in favor, say aye.
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 So carried. Thank you. We'll recess the Commissioners' public meeting at this time and convene the salary board actions.
Commissioners, we're asking you to update the salary schedule. First, reclassifying the maintenance 1 position to a maintenance 3 position, pay grade 7-8, effective June 28th, 2020. And then the removal of the 1 part-time Veterans Affairs assistant position, pay grade 6-7, to be effective June 13th, 2020.
Okay, so we're removing 1 full-time position, or part-time
Part-time.
position, and we're upgrading a position due to the skill set
Correct.
of the person who's bringing it to the county and his construction experience, which will be a great benefit, especially with projects moving ahead. So,
The removal of the part-time veterans position is consistent with what the commissioners said they would do when they created that, which was to help during a transition period.
Correct.
Oh, am I correct on that?
That's correct. We
Yeah.
had 2 new employees in that department that needed certification, so this got us over the certification.
okay.
I'll make the motion.
I'll second
All in favor, say aye.
it.
Aye. So carried.
Thank you.
Thank you. Thank you, Nikki.
Morning, Commissioners.
Morning, Maya.
I have 2 RFPs that I'm requesting. The first one is an RFP for Employee Health and Wellness Clinic, and this is to seek medical providers to see if they can provide us with a health clinic for our employees and their dependents. The next one is an RFP for health insurance broker services to make sure that we are getting the best cost-effective plan for our employees.
That's a good point. As we move forward, we want to make sure that we look at all our options out there as we move forward with employee health insurance and what's most cost effective, what can be effective for our employee, at the same time be cost effective for our taxpayers, which includes the employees. So we want to make sure that we do all our homework before we move forward. So thank you for putting those RFPs out.
And I also want to thank you, because during this time, with the CARES Act stimulus program and everything that's available, we rely upon you and a number of our planning staff to go seek that money and present it to the community, not just us, as to is it something that we should be applying for. And it's pretty amazing how much we are applying for and receiving. And I want to credit you for your due diligence. I'm very good at that.
So with regard to the clinic, Commissioners Macera and I visited a clinic, it must have been 3 years ago, in New Jersey. And what we found was that there was a lot of savings when we talked to the county executives. They have a different name down there for their commissioners. And a lot of positive use by employees. It was not mandatory, it was voluntary. And as part of our self-funded care that we have now, or in the event that we change to a fully funded program, we hope that having a clinic will both improve the health of our employees and save taxpayers money.
And clinics are becoming more popular. It helps the employees where they don't have to schedule for a doctor's appointment and wait 6 or 7 weeks to get in. They can go right down to the clinic and be seen. Penn College here locally has a clinic for their employees. It's very effective. So we're going to research this and see what we can do. So, thank you. And it's very true. We've dumped a lot on Maya with these, and you'll see this as we go down through the action items. You'll see the different grants that the county has applied for, and that has the DNA all over it from our procurement office and planning as we move forward to try to secure some of these monies for the county. Thank you.
We love Maya.
Okay, at this time, we'll move to the action items, and we're going to jump ahead. Yes.
Director McDermott is going to present 8.11.
Commissioners, this morning we'll continue the discussion on Roads to Freedom Center for Independent Living funding request to transition individuals with disabilities out of congregate living settings in services through the disaster relocation and relief program in the amount of $250,000.
So, Mr. Chairman, I will put this in the form of a motion because one of the things I mentioned to Maya when we prepared the agenda, all the items say approve, 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 which actually I think means vote. Probably should say vote on those various things because we don't know whether they're going to be approved or not. So I guess what I would say to the board here is that it's my belief that we're going to vote on a proposal for disaster relocation and relief today. And if there needs to be a formal motion to that effect, I'm happy to make it. If the board thinks they need more time to discuss it, I'm happy to accommodate that too before I make the motion. But I think that in the future we should have our agenda items read just vote on those things so that it doesn't imply that somehow we've already decided these items and that we're merely approving them. Because I notice if you look at the action items, they all say approve. When you get down to 8.11, it says discuss. And actually, I think that we intend to either vote up or down, although if the board thinks they need more time, I'm happy to discuss that too. But the point is, I guess we have to come to some resolution on this, whether we're...
Yeah, Commissioner, we're going to come to a resolution today. You asked for it to be placed on the agenda. It will be voted on today. I do not need any more time. I've done a ton of homework on this.
Yeah.
And I'll cite my homework as we go through this action item.
Okay. Well, I'm certainly happy to have discussion, to make a motion that we approve the $250,000 request for the disaster relocation and relief program. And if there's some need to modify that amount, I'm open to that too, but at this point I'd make a motion to approve that.
Is there any discussion?
Commissioners, technically this needs a second. The seconder does not have to vote one way or the other, but can vote against or for. So technically there should be a second to make this an item of discussion. Otherwise, the
Okay.
motion dies.
I'll second it for discussion. Okay, discussion.
Well, I can tell you that what I think I'd like to do is have the folks who are here today, who have made a presentation. We each received a packet of information which they sent to us, but I think I'd ask probably the director for the Center of Independent Living to step to the podium and tell us about the program, and also the other folks who are here today are welcome to speak. I know that there are people in the audience who want to speak also. I see at least half a dozen people.
That's fine. I'll just ask that it be limited to the 3 minutes.
Hi, Commissioners. My name
Morning.
is Good morning. My name is Misty Dion, and I am the CEO for the Roads to Freedom Center for Independent Living. I've been employed there for over 15 years, and we work with the state and managed care organizations across the state to help provide in-home services and coordinate services for people to move from nursing home transitions into the community. And we help provide preventative services for people to remain in the community. We have an array of services, but the program we're here to talk about today is the Disaster Relief and Relocation Program, which is a program that allows people who are in congregate settings who decide or wish to be in a cohort setting, an individual setting where they're not sharing a bathroom and a small room, the option of getting health care round the clock in a hotel or a single room. Dormitories are often used as well. and they'd be receiving 3 meals a day based on their independent service or their individual service plan. So we work with a team of nursing staff, physicians, rehabilitation staff, and family support to make sure that the individual gets all of the services that they're getting in the nursing facility in the cohort setting. We also work with them to help provide an expedited enrollment process with the state so that if they're eligible and interested in having those waiver services, follow them back into the community rather than going back into the facility, that they would be able to do that. We help with assistive technology, home modifications, and finding affordable, accessible housing. We come to you today to ask you to please consider, and the information that I provided was national and state support to show that, you know, in these congregate settings, it is unsafe and there is not a way to socially distance. And so for individuals who are interested in this program, if you would put some funds, we specifically when asked, we asked for $250,000, which we would individually ask for reimbursement. We would front the cost and ask for reimbursement upon the use of those funds bi-weekly or weekly, whichever you prefer. So I hope that you'll consider helping us save lives and allocate some funds so that we can provide health care in a safer setting for these individuals.
Okay, thank you.
Mr. Chairman, before we continue, I want to read into the record some of the formal proposal, and specifically because one of the constituents had mentioned earlier that his mother did not want to go to the home. This is a voluntary program. This is not a mandatory evacuation of the home. It's not required. May 27th, 2020, Lycoming County Commissioners with our address. This is a letter from the Roads to Freedom. Please note that this correspondence serves as a formal proposal for the Lycoming County Commissioners to assist with the evacuation of county residents within Lycoming County. The Roads to Freedom Center for Independent Living is formally requesting financial support in the amount of $250,000 to be allocated for up to 90 days per participant to assure the care, safety, and welfare of the residents in this facility. In order to be able to educate the public, we are allocating $5,000 to a marketing campaign for community members, stakeholders, and human service professionals. This is an essential piece of the proposal to ensure we are offering this service to as many participants as possible. Roads to Freedom is approved by the Pennsylvania Department of Human Services to provide nursing home transition called Community Health Choices. Roads to Freedom is contracted with the state of Pennsylvania's 3 managed care providers, UPMC, PA Health and Wellness, and AmeriHealth Caritas. Roads to Freedom is licensed by the Pennsylvania Department of Health to provide in-home care. Roads to Freedom is credentialed by the National Committee for Quality Assurance. Nursing home transition is a core service for the Center for Independent Livings all across the United States. Nursing home transition is not a new program. Roads to Freedom assists to transition people with disabilities to return to the community versus having institutional care. Medicaid pays for care in both congregate, which I'm just adding here as group, and community settings. This assures that people can receive both skilled nursing and attendant care services in their home. The coroner reports 23 institution COVID-19 deaths in Lycoming County. The residents are forced to share rooms, some with 4 beds per room. Staff are forced to reuse disposable PPE, increasing the spread of the deadly virus. Residents that have not been tested for the virus are forced to room with others that have been confirmed COVID-19 positive. Residents that have been hospitalized due to COVID-19 are expected to return to the facility. Many nursing facilities are clearly not able to control the spread of the virus. The only hope to save these lives is to transition people with support to the community. Funds are available from FEMA to pay 75% of the cost of shelter and food. Roads to Freedom has the support of a county businessman that is willing to allow the residents to shelter in a currently vacant hotel. He's willing to forego 25% that these federal funds will not allow. The hotel will provide 3 meals per day to the people that choose to leave the facility. Not only does this allow people a safe place to quarantine, it will occupy hotel rooms and put dining, housekeeping, and custodial staff back on the payroll. Roads to Freedom has been contacted by 10 families that want to pursue community health choices. As nursing facilities are not permitting families or advocates to enter the facility, we've been not able to contact all the residents. The requested resources will provide the necessary staff coverage to offer each person their own room. This will allow them to properly quarantine. During the quarantine period, the person would have one staff, a live-in for those that require 24-hour support, greatly reducing the spread of COVID-19. Both staff and those in quarantine will be provided with necessary appropriate PPE to assure no further spread of the virus. This will be effective to assist the county to move to green. Well, this letter obviously came prior to us moving to green. We've contacted home care agencies that will provide the necessary staff to accomplish this. The current rates for 24 hours of care with a person that's COVID positive is $315 per day. Care for people that have been tested and not found to be infected is $269 a day. For residents that do not require 24-hour care, the hourly rate is $16. Recently, the governor has discussed hero pay for home health aides. This could result in higher rates. Roads to Freedom would submit weekly invoices to the commissioners for compensation for the direct care worker. The cost of care for 10 individuals for 30 days if COVID positive is $94,500. Resources would also be used to secure the appropriate PPE. Once the quarantine period ends, the resources will be used to continue to provide care to these people until they're able to safely return to their home or other accommodation that does not risk their health. At this time, we are unsure of how many people we will assist to transition. We anticipate more requests for service once all families are informed of this option. We've already initiated the transition process for one resident, and I'm sad to say, but I believe that resident has died. Please contact us if you have any questions regarding this proposal. So that is the formal proposal from them. And as I listened to Ms. Dion speak, it occurred to me, especially as we were talking in the proposal about making funds available to make homes available for people who want to transition out, that we do this with STEP. We spend hundreds of thousands of dollars, and in a good way, to help seniors who want to stay in their homes. The only difference is that they may or may not have a disability, and they are not, it's not being done in response to the COVID-19 pandemic. And I think that what we're trying to say today, when we look at the number of cases of deaths, that the overwhelming majority have occurred across the country in our nursing homes. And that's a fact. And so it's not a, we don't need to pass judgment on the nursing homes. We need to simply take action to try to transition people who want to leave and who want to live outside of an institution in a group, who want to live out of a group setting and into a single setting. And as I said last week at the meeting, we did this with the prisons. We got people out of the prisons, and we continue to try, and the courts are trying not to have to put them in. We did this with the schools, which is why we shut down the schools. And we've done it with other places where people are living sometimes against their choice in a group setting. Ms. Dion, do you have any other people who want to speak on the proposal? Oh, by the way, I would like to put this into the record today, this whole packet, as part of the minutes for today's meeting, and I've given a copy to Ms. Ebner earlier at the start, but I'll just put it into the record.
And for the record, I have received a copy of that and have read it.
Thank you.
Yeah.
Morning, Commissioners. My name is Jody Bainey. I work at the Center for Independent Living.
We can't hear you with the mask on, and it's not going to record over the live stream. And you have to hold the mic. Try not to touch the mic, but you need to get closer to it.
Okay. My name is Jody Bainey. I work at the Center for Independent Living. I come today and asking for your support for our proposal that we've been proposing for weeks. Rick did mention one of our residents we were working with did pass away last Sunday. We were set to transition him that week. But as we are here, we are wasting time that we could be spending on transitioning residents. We ask for your financial support, and yes, I know there's been a lot of focus on the $250,000, but as stated, we would bill weekly. And also, I know it's been said in the past meetings that you don't hear the public outcry. Part of that is because we don't have access to the facility, which we continue to work on, continue to advocate for that. But also, that's why I ask for your support even more, financial support. If you don't hear the public outcry, there's not going to be anything in it for you to lose. If nobody transitions, nobody transitions. There was nothing in it for you to lose, only to gain, and for the residents of Lycoming County to see that they do have your support in the time of crisis. So we are working with other counties in Pennsylvania to do the same. If you're not aware, the same situation is now happening in Northumberland County in another Manor Care facility, who again had no residents that were positive. That changed. From Thursday, they had 11 residents who were positive. By Friday morning, they had 17. By Sunday morning, they had 33. 33 of 53 residents. Again, not our county, but this can show you how well and how quick that can change. So although we are dealing with one main facility in our county, tomorrow that could be a different situation for Valley View, for Roseview, or Williamsport Home, or the other 2 Manor Cares, and any other nursing facility in our county. So although this isn't a problem, or you say it's resolved, tomorrow could be a different story. So we ask for your support. Let's be prepared in case that does happen, and hopefully it doesn't happen. Thank you.
Thank you, Jody.
Excuse me. My name is Karen Koch. I'm a resident of Lewis Township. I'm here to discuss the item on the agenda, the support for the transition of individuals from Manor Care or other facilities in Lycoming County to community living. As I look over the budget, and I've attended many, many commissioners' meetings, and there's great discussion over responsibility with funds. We need to be responsible for funds. And I do understand that. And I just want to remind folks that the cost to care people when someone's living in a nursing home, Medicaid is paying 24 hours a day to have that person cared for, when in actuality it is 2.7 hours of care that a person receives. I work with a few folks that have disabilities who have been up to this podium in the past few weeks and have talked about how their life is, one phone call away. That personal care attendant calls and says, hey, I can't make it in. I've had there's no one to cover you. You're going to end up in a nursing facility. That's not okay with me. That's not okay with me to look at members of our community who know that there are options. Many people are in that facility because they don't know that they have an option, because they've been told by their doctor, maybe their clergy, this is the best thing for you. We know now that that is not the case, and we are here to ask for your support. We talk about fiscal responsibility. You can care for 3 people in the community for the cost to care to 1 person in an institutional setting. So again, I'm here to ask for your support, and we hope that the commissioners will do the right thing. Thank you.
Thank you. Any other comment? Okay, over the past week, I have put a great deal of time into this. As I did previously, I researched things, but this past week I spent a lot of time on this. And I want to highlight some of the things that the county has, when there's been comments, there's been no communication. I'll reveal that here today. May 13th, received an email from Ms. Dion explaining the Roads to Freedom Center for Independent Living background. She also proposed that the county work with them on expediting the transition of folks out of the Jersey Shore Manor Care. Same day, Commissioner Mary Beto responded back to her email that the county commissioners are very concerned about the situation at Jersey Shore Manor Care. We would review the materials and contact discussing the situation further. He went on to add an email 6 minutes later that he was forwarding that email that he received from Ms. Dion to the senior leadership team for a 1 o'clock phone call to discuss. Same date, Commissioner Mary Beto was not available to be on the call at 1 p.m., but expressed that SIL has the legal authority to enter Manor Care and transition residents. They would work to get strike teams of attendants to care for the individuals. He believes that Kelly Robinson with our EMA department may be able to treat this as any other natural disaster response. He asked for the feasibility of taking action to be discussed. Same date, Director McDermott informed us after the call that the county does not have the authority to intervene since we do not have a Department of Health within the county. If we did that, change things drastically. Department of Public Safety stated that the Pennsylvania Department of Health and PEMA are in regular contact with Jersey Shore Manor Care, May 13th. May 15th, Kelly Robinson of EMA reports back, after doing her research, since she had very little knowledge on this particular subject, she reached out to the state partners at PEMA and the Department of Health. Some of the information she collected from Christine Heisner, Department of Human Services, to clarify whether or not this type of non-congregate care would be covered by the disaster declaration, awaiting answer. Christine also stated that the waiver would be the biggest hurdle to jump in the whole process. The waiver approval is rather lengthy. They did not find any info to expedite it due to COVID. 2, received a copy of the letter from FEMA to PEMA Director Padfield that stated in the Commonwealth, non-congregate sheltering was only approved for reimbursement for homeless populations, first responders, and healthcare workers. FEMA will not reimburse for the sheltering of individuals that are not part of one of the aforementioned groups. Not sure if Christine could get a different answer. The Pennsylvania Department of Health said they provide healthcare risk management. Hospital associations of PA, PEMA, and their office has been working with Manor Care since the very first couple of cases that were identified. They have helped with infection control issues, procurement of PPE, and Manor Care Corporation has contacted with outside agencies to assist with staffing. Conference calls with all the mentioned agencies began that past Tuesday to assist in even more coordination between everyone. The facility is following the guidance information that's being pushed out by the Pennsylvania Department of Health. And this is the information that Kelly Robinson received on May 15th. She said she'll continue to do research and reach out to the state partners to hopefully get more information and answers. If anyone had any questions, don't hesitate to call her. May 15th, I thank Kelly for her research and attention to this matter. May 21st, an email was sent to Representative Everett that was forwarded by Commissioner Mirabito. The email was from Ms. Dion requesting a meeting with Representative Everett and Commissioner Mirabito. Representative Everett fully supported the possibility of utilizing FEMA Public Assistance Category B funds to relocate individuals from institutional settings. However, his question was, after the FEMA funds go away, who pays for the in-home care? County, state, or federal? Commissioner Mirabito responded that he was going to set up a conference call with Representative Everett and Ms. Dion to expedite. Misty responded and thanked Commissioner Mirabito. May 22nd, a local hotel developer offers assistance in providing hotel rooms as an alternative to residents currently in the nursing homes. May 24th, Ms. Dion texted the three commissioners and stated that these people need is for the county to allocate $250,000 to start so that we can pay for temporary care. She hoped the allocation to be passed at the next commissioners meeting. May 26th, Ms. Dion text and a group text during the commissioners meeting, will we be voting on the allocation of the requested $250 to provide relief? Commissioner Mirabito responded during that meeting that he was going to bring it up under commissioners' comments, but probably could not vote today. She responds, oh, that's great. Again, no action. May 27th, the meeting that was scheduled for May 28th with Representative Everett in Sill was canceled per Commissioner Mirabito. May 29th, a text from Ms. Dion at 10 p.m. another death at Jersey Shore Manor Care. Commissioner Marabito responds, we will all continue to work on it. June 1st, a text from Miss Dion. Every day we wait to help these residents is a day we risk adding to the death count. The next day, another text. Like lambs led to a slaughter. June 8th, another text from Miss Dion. Will you vote tomorrow on the $250,000 allotment? Not grant to save lives. Please consider these residents are not only fearful for their lives, but also of retaliation. Strong statement. June 8th, text from Karen Koch. People continue to die while you're undecided on this commitment. I'm not sure why this conversation is continuing. June 12th, an email sent from myself to Jody Bainey that I'd be willing to meet with her and discuss any thoughts, especially regarding future planning. I state I'd be willing to write a letter of support to help bridge the communication to Jersey Shore Manor Care. The next day, which was a Saturday, Jody responded via email that Misty was out of town currently and she really should be part of the discussion. She also extended an offer to all 3 county commissioners to the transition of a Manor Care resident last Tuesday, but acknowledged we may still be at our commissioners meeting that was going on at that time. Friday, June 19th, I sent an email to Representative Everett. Received an email back. The last he heard from Department of Health was on May 19th. When they informed him they were aware of the issue at Jersey Shore Manor Care and were assisting as necessary. He had stopped making inquiries after that because the new cases and deaths had stopped. He had not been contacted by any individuals or family members wanting a resident to leave. He also questioned where the long-term funding would come from once the disaster is over. In his email, he had stated he had asked Commissioner Marabito that when he was first contacted about this, and Mr. Marabito never answered his question. June 19th, the same day, I received an email from the coroner last Friday that he spoke to the Manor Care Director of Nursing. He was informed that they had 22 residents that continued to test negative. All the previous positive residents would now be considered as having gone greater than 2 weeks without symptoms. They were not aware of any family members asking to move residents out. The residents that could speak for themselves do not want to leave. I spoke to the Public Director of Safety, Jeff Hutchins. He said the last reported case from Manor Care from the Department of Health was May 10th. The last reported case was May 10th to the Department of Health. Yesterday, I contacted Commissioner Ridgway of Columbia County. The Center for Independent Organization services numerous counties. They have 34 deaths in nursing homes in their county. I asked Commissioner Ridgway, did the Center for Independent Living contact Columbia County to ask for any monies? Commissioner Ridgway says they have not been contacted at all from anyone regarding transitioning people from nursing homes. So that's a question also. Back to May 19th. I have a series of emails from Garth Everett to David Toth wanting answers. He attached an article about the virus at Manor Care and had sent it down to the state. And at that time, he was looking for answers. Answers were not being given. At some point, as he stated in his email on Friday, those answers were finally given, and he felt that the state was doing what they needed to do to address Manor Care. As he stated in his email on June 19th, I stopped making inquiries after that because new cases and deaths had stopped. He had not been contacted by any individuals or families wanting a resident to leave. I have asked for the past month if there is anyone out there to please contact us if they wanted to leave. I have said that over and over and over, not only here, but out in public. I have still yet to receive one phone call from a resident or a family member asking, please assist me and get me out of this home. I have received, or I've had conversations with 3 family members who have family there. And I've asked them, do you want your family out of there? In all 3 cases, no. They're receiving the care that they need. 2 of the 3 were COVID positive. I have gone back through the history of this. It's unfortunate that people have passed away from this disease. No one wants this. But I feel it's not the commissioner's responsibility to allocate monies to move people that haven't requested to even be moved. I have talked to health officials. Our coroner he's sitting in the back of the room. He has relayed information to us. He's researched it. Our Department of Public Safety has researched this. Our state representative assigned to this area has thoroughly researched this. Commissioner Mirabito has looked into this. He feels very strongly another way. But after the homework I've done, and from the experts I've talked to in the health field that work for the county directly, and from the reports that are coming to Kelly Robinson from the state, this is what I've done this past week. This shows otherwise.
So what do you have to lose? Nobody wants out.
Mr. Chairman.
Yes.
I think the issue here is important not to focus on Manor Care alone. Manor Care is a symptom and evidence of what can happen when you have cohort living or congregate living. Manor Care is an example, and all the nursing homes across the country are examples of what happens in congregate living. That's why we were so worried about the prison, because we were concerned that if an epidemic broke out. By the way, I appreciate the efforts that you've put in. I think at the end of the day, it comes down to all of us making choices about how we're going to spend public money. I mean, listen, you know, you and I may or may not agree on this, but the fact is that we make choices every day of the week about how we're going to spend public money, and I guess what I'm suggesting is that I think it's important for you and your colleague, Mr. Massera, I don't know where he stands on this now because I haven't heard from him, to step up and say, okay, you know what? We gave $1 million to the Chamber of Commerce to buy land at the Lycoming Supply with public tax dollars land that they're going to make a ball field into. And they're basically going to make a baseball diamond, right? So that's use of public money. That, by the way, is just $1 million just for the purchase, or $900,000, and then they want to use 2% of that money on a continuing basis to fund it. If there's deficit funding, to fund it. Now, I have to ask myself when I'm presented with this, is it responsible or not responsible for me in a crisis and a pandemic, as a board, is it responsible for us to say, hey, we're going to make the funds available? If only one person transitioned, only one person transitioned. Last week, we allocated $150,000 to help people in the pandemic with their businesses. There are many people out there who might say, hey, you know what? When you set up a small business, a private business, you took the risk. You took the risk. And, you know, one of the risks you took is there might be a pandemic. Did we say to ourselves that we want to know where they're spending the money? No. Did we want to know, are they going to repay it? No. We said to ourselves, we're going to help them. We're going to help them because they're in a crisis. Well, these are people in a crisis. And if it's only one or two or three, and by the way, the fact that another county hasn't done it should tell us that we need to be leaders. You know, I've heard a lot of us talking about what we should have done during this pandemic differently. And what we have an opportunity to do now is to learn from the mistakes that have happened and to try to move forward in a way that's positive and move forward in a way that we provide leadership. I don't necessarily, you know, the facts you went through on the dates, it's very hard for us all, when I say us collectively, I mean the whole country, the whole world, to understand with this pandemic what's happening, because we haven't had that before. So, you know, should the Department of Health done something earlier with nursing homes? You know, yeah, today we can definitely argue they should have. But I guess what I'm trying to say is that we have an opportunity now to treat this problem the way we treat so many other problems that come to us for public help, for public financial help. That's what I'm asking you two to consider today, that we have a chance to step up and be leaders about this.
Commissioner, I'll just add to that, at this point, according to all the documentation, there is not a crisis there right now. And
What about tomorrow?
the last reported, please do not interrupt me, or I'll ask for you to be removed from the room. The last reported case was May 10th from the Department of Health. We have businesses that are in dire need. They came to us. They asked for assistance. So we are assisting them. I have asked over and over and over. I have yet to have my phone ring with a resident that wanted to be removed.
So I think, you know, look, having had a mother who was 91 years old who, when she was dying of lymphoma and was in a hospice or at one point in a rehab facility, I wouldn't have expected her to pick up the phone to call. She barely recognized us, and all of us who have taken care of our parents through their last days understand that, whether those last days are 16 months or whether they are 6 days. So I understand what you're saying. Families don't know what their rights are. I mean, that is just a fact. Families don't know that they have a right to have care outside the home, as much right to have it outside the home. That's why I read you in the proposal that they're licensed by the PA Department of Health. By the way, to be accredited by the National Council on Quality Assurance is not an easy task. It means that everything you do has been scrutinized. It's like an audit, but it's not just like a general audit that we do. It's like a forensic audit. They look at everything you do, and they're checking whether everything you do is in compliance with certain standards. And by the way, that is what hospitals have to do also. They go through that.
Non-nursing facilities.
Not nursing homes, right. Nursing homes do not have to be. So anyway, yeah, that's a good point. Nursing homes don't have to be, but you folks, when you provide the care in the community, you do. But anyway, so Commissioner, I think it isn't whether it's a crisis now. There is a crisis ongoing. I mean, whether or not more people die at Manor Care or at another home doesn't mean there isn't a crisis. I thought that Ms. Bainey's description of what happened in Northumberland County was really instructive. How in the course of like 5 or 6 days it spread.
And Commissioner, the states are sitting on the monies that are designated for this. Okay, this isn't the county's responsibility.
Well,
okay, it is the state. The Department of Health has monies earmarked from this, along with other monies that the governor is sitting on that are not being released to the counties. And those are the monies designated for this. That's why last week, I think it was last week, or it might have been the week before, I directed my comments to Ms. Bainey. Your frustration is vented at the wrong entity. You need to speak to the Department of Health in the state about those monies being released.
Well, I have to beg to differ with you, because one could make the same argument about the money for the businesses. Hundreds of millions of dollars is coming from the federal and state government for the businesses. And we could have said last week, we're not going to allocate $150,000 to the chamber program because there's federal money coming. Not to mention that people have already had an opportunity to apply for PPP and for other monies. So I think that argument is not one that we should hang our hats on. But I'll tell you, regardless, let's take your argument and assume it's correct. I don't think we wait for people to die while we wait for the federal and state government. But I think it's incorrect anyway, because quite frankly, all emergency management originates at the local level. When we have a flood, we don't wait for federal and state government to tell us. We declare a state of emergency. And once we declare that state of emergency, we then use the funds to save lives. And that's what we're trying to do here. So, I don't know that I can change your minds. I don't know whether the people in the audience, some of whom are in wheelchairs, some of whom are paraplegics, some of whom are in this community who are quadriplegics, I don't know that they can change your minds either. At a certain point, I just don't know.
Commissioner Massaro, you have any comments?
Yeah. Ms. Bainey, I appreciate what you advocated. Ms. Bainey, I appreciate the way you advocated for the seniors there at the Manor Care, and I appreciate your time. I have to say that in agreement with Scott, responsibilities of the commissioners are budget, economic development, maybe even some quality of life, and to place the responsibility of healthcare onto a county is not our role, nor should it be. I agree with Commissioner Scott Metzger that this governor has sat on money, did not allocate it appropriately in the beginning. We did not learn anything from New York. And there was tremendous amount of data showing that that governor made a bad mistake by doing what he did in the nursing homes. And we almost basically followed. So, again, I appreciate the way you advocate for your business and your seniors. Careful.
By the way, I just want the record to be clear, and I'll ask this to the Center for Independent Living. The Center for Independent Living is not getting anything out of these funds, correct?
Not a cent, not
Right.
one cent.
Right. In other words, you've expended funds that you raise as a nonprofit. You've expended those funds to help people and to do everything you're doing. You're not going to get a penny of the $250,000. It's going to the taxpayers and the people in this community who are becoming positive and dying from COVID-19. Okay.
That's why the proposal included that you guys would receive the invoice, it would be transparent, you can see where everything
Yeah,
went.
for the record, that's why she's saying that the invoice would be transparent and we would see. By the way, I want to put for the record, that is an incredibly far cry from the lack of transparency, where over the last 10 years, boards of commissioners have allocated $10 million to the Chamber of Commerce, which we don't know where any of it's gone. My colleagues don't want to hear about the hotel tax, but the truth is that we have two standards in this community. And quite frankly, it's disappointing. It's extremely disappointing.
The last thing I'll mention is there was an article in the paper last week, I believe it was Saturday's newspaper. It talked about the ManorCare Jersey Shore. There have been no new cases or deaths reported. There are now 49 patients who have recovered from coronavirus and one inpatient in-house recovering from COVID, according to Julie Beckert, Assistant Vice President. She's keeping the local media abreast of the situation at ManorCare since the virus rapidly spread throughout the home. She reports Friday there was a total of 77 patients who had tested positive for the virus, along with 19 employees, all who have recovered.
Excuse me, Commissioner Metzger, who's Julie Beckert? Not familiar with her.
She is the Assistant Vice President and Director of Marketing Communications for ManorCare based out of Toledo, Ohio.
So she's not local at all. She's
Yeah.
a corporate person in an office for a company that makes
Just reading you the story, it was in the paper, ma'am.
$8 billion a year, so yeah, she's.
These are the facts that are being reported. Okay. At this time, we have a motion on the floor.
We have a motion on the floor and a second, yeah.
All in favor of voting for the request to transition individuals with disabilities out of congregate living settings into home services through the disaster relocation and relief program in the amount of $250,000? All in favor, say aye.
Aye.
Opposed?
Nay.
Nay. The motion does not carry as for a 2-to-1 vote.
Can I ask a question?
Thank you.
Can I ask a question?
Yes.
Got to go to the mic.
You gotta go to the
to
mic.
the podium.
Please keep your comment brief or question brief.
Do you have a family member who works in ManorCare or in a nursing facility that would cause any conflict with you seeing this from an outside?
Absolutely not.
No?
Absolutely not. Where my relatives work have nothing to do with my opinion on anything. I always draw my conclusions on anything after my research.
Well, there's two things that I just want to mention. The Christine Heiser,
Mm-hmm.
the woman who works at the Department of Health
Yes.
Emergency Management, I'd be glad to have a conversation with you and her present. I have a video recording of her doing a presentation on a disability disaster, a national forum, where she backs this program 100%.
Okay.
And some of the texts that you read, though, weren't necessarily mine, but I wish you would have spent more time looking at the proposal and not clouded the view with any of the other, we don't stop working. These are people's lives. So at 10 p.m. when I'm texting, it's because I'm getting phone calls from people who I'm surprised that you haven't heard from, but not if you have relatives who work or are in healthcare, because people are scared. They're dying. So.
Thank you. Okay. Yeah, go back to action item 8.1.
8.1, Maya Toon, approve COVID-19 county relief block grant application.
Morning, Maya.
Good morning, Commissioners. This is an hear me? This is a grant application we submitted last week due to it being a tight deadline. The county submitted for $1 million grant. Of those monies, a 2% administrative fee was applied to that, and $980,000 was allocated towards projects as identified by DCED as eligible uses. And some of those we put towards was for nonprofit assistance, small business grant and programs, broadband internet deployment, as well as municipality relief.
Maya,
Yes.
would you look and see, you specifically said nonprofit, will you look and see whether these funds are eligible to be used by the Center for Independent Living as a nonprofit? And then let us know. They are a nonprofit, and I'd like to know whether the county can allocate those funds for the purpose of that nonprofit. I mean, you don't have to tell me now, because I know you need to
Sure.
go back.
Yeah, I'd have to get a clearer, obviously. 'cause
Right,
it's
I
very
understand
brief.
that. And, you know, if you forward to me through hard copy what DCED has on it, I will review it also,
Okay.
because I have a funny feeling that it might be eligible. Thank you.
And just to further clarify with all of that too, you know, we put in for those monies on how we're planning on dispersing those. We haven't obviously did that. We just put in the funding because we knew there was a need. And then
Right.
as more guidelines come out, we'll share that with the commissioners as well.
Right, we haven't allocated them anywhere else yet.
Correct.
Right, thank you.
Yep.
Okay, motion to approve.
I'll move to approve, accept the grant.
All in favor, say aye. Aye.
Aye.
8.2, Maya Toon, approve resolution 2020-13.
Morning again. This resolution actually goes hand in hand with the COVID relief block grant application. And I wanted to make a note on this is that in constant contact that I've had with DCED, it was indicated earlier on through this CARES funding that the county would be eligible at some point for $10 million. The county and the planning department, we've worked very close on all of this, done a great job, I think, of trying to secure as much money as we can. In my dealings with my point of contact with DCD, I was notified yesterday that the county now is eligible for the $10,231,903 that come back to Lycoming County. So this is going to be in connection with the $1 million. Whether that's going to be in addition to or as part of our application is yet to be determined because no formal guidelines have really come out. But I just wanted to make note that, so really, although it says $1 million because that's what we applied for, they have now said we are now going to get that $10 million. So great news, but got to figure out the rest. So.
What was the exact amount again, Mike?
$10,231,903. And there's different, there's 7 different funding categories for which we are eligible to use it towards. If you'd like, I can go into detail about that if you want. But the first one is offsetting the cost of direct county response planning and outreach efforts related to COVID-19. The second one is assisting qualifying municipalities located within the county to offset response and planning efforts related to COVID-19. Small business grant programs to support businesses with fewer than 100 employees and to support businesses and other entities that are primarily engaged in the tourism industry. The fourth category is grant programs to support the following entities for costs related to assisting businesses during the COVID-19 disaster emergency: CEOs, LDDs, IRCs, SBDCs, and EDCs. Behavioral health and substance abuse, use disorder treatment services, broadband internet deployment with priority given to unserved and underserved areas, and then the last category, qualifying nonprofits. Again, what I was told was that once we accept those funds and we move forward with this resolution, then the guidelines will be set out and laid out within the next 2 to 3 weeks. And at that time, then I will have a meeting with the commissioners and we can, and planning, and then we will figure out how to administer these grant funds within the community and within the county.
Same question I raised before. I believe that some of those funds might be eligible for use in this area. Specifically, the mention of the nonprofit, or the business, I think, the nonprofit business.
Qualified nonprofits.
Yes. I don't know whether that's only, it sounds like a lot of it's geared towards tourism and economic development with those. But I'd be curious to know.
Okay, a motion.
I'll move to approve.
Second.
All in favor, say aye. Aye.
8.3, Maya Toon, approve resolution 2020-12.
Yes, this, again, is part of a project that was done previously, as everyone's aware of, the RACP Levy Improvement Project. As part of that grant process, we have to submit a resolution authorizing the chairman, Scott Metzger, as the designated agent to sign off on all grant-related documents for this project.
And as I mentioned to you earlier, on these, the same thing, the prior one was a resolution to authorize and designate the chairman to sign. All of these will come before the commissioners.
That's
so that,
correct.
Right, so we'll know where it's going. He's just signing, so they have one point of contact.
That's correct. And that is these resolutions are coming directly from the state. They draft them, they tell us what they want in them, and we have to just fill in the blanks.
Okay. Have a motion?
I'll move to approve.
Second.
All fair side?
Aye.
8.4, Mayatune, award BJA Coronavirus Emergency Supplemental Funding Program grant.
This was a grant application I submitted back on May 29th. It's for Bureau of Justice Assistance Coronavirus Emergency Supplemental Funding. And it's used to prevent, prepare for, and respond to the coronavirus. We submitted for $58,008, and I'm happy to announce that we were awarded that grant application.
Any discussion on this item? Yes, I'm sorry.
Should I go up there or?
If you just take your mask down, we made them.
Thanks. I have
Yeah.
a big mouth anyway. Isn't 8.4 basically the same thing as 811? Am I reading this wrong?
This one is this is through the Bureau of Justice Assistance, so this is actually geared towards law enforcement.
All right.
Although it's to prevent and prepare, there is a specific use towards law enforcement and court-related type processes and disinfecting, those kind of things.
Okay.
Yes.
I understand now. I didn't
Okay.
before.
Okay. Thank you. Motion to accept?
So moved.
I'll second.
All in favor, say aye. Aye. Carried, thank you.
8.5, Mayatune, approve application to PHFA CARES Rent Relief Program.
Yes, this is another CARES Act funding that came through the county that we were eligible to apply for. The county applied for $460,000. It's for rental assistance. This will go hand in hand with our supportive housing program. STEP is going to be our designated agent in order to apply for those funds for us and to administer those funds. And it's through the Pennsylvania Housing Finance Agency.
You know, we had a conversation earlier today, or this morning, and it also is for the landlords as well, correct?
That's correct, both landlords and lessees.
And we do know that there are a number of landlords that are currently way behind in their mortgage and is in jeopardy of losing these investments. Not only because the people were unemployed, but they decided not to pay or get evicted. And I think in Pennsylvania, it's still July 10th. I'm not sure. Each state is a little bit
Yes,
different.
July 10th.
July 10th.
Yes.
And we are allocating that money to STEP, correct?
STEP, yeah, they're gonna, so basically what happened, right now, we really don't know just the basics of how we can use it, median income, that kind of thing, but the rest of the guidelines will be coming out after a formal award has been made. Again, it's one of these things where they're pushing out the money as fast as they can, and unfortunately, they're just thinking about how it's all going to work afterwards. So I'm hopeful that once we receive notification that we'll have more formal guidelines as to how the funds can be used towards landlords and to lessees. So I guess what I'll say is that I'll make, STEP aware of our concern about landlords incorporating them into their plan. And of course, myself and planning will be involved in that entire process as well.
We'll see what guidance they give.
Sure.
Thanks, Maya.
Uh-huh.
Maya,
Yes.
I think the major guideline is the income eligibility. On the fair funds, that's always the big.
It is,
The
yes.
big. They want the money to go. I think it would be helpful if you could ask them specifically if someone meets the income eligibility and they happen to have a disability, can we get that fund, use those funds? And I'd be surprised if the answer was no, because this is money like the other fair money that I mentioned earlier. We've allocated I don't know, probably up to $1 million of repairing seniors' homes as long as they meet the income eligibility.
Correct.
This is a situation where the Center for Independent Living, if they have a way to bridge the gap during the quarantine period, could take the money, we could take the money and say, okay, look, someone is out, they quarantined for 14 days, now we're going to find them a place to live. Oh, and by the way, they only have an income of $800 a month because they're on Social Security. Because quite frankly, a lot of the folks at the Center for Independent Living who work with them are living on $800, $900, $1,000 a month. So they're going to meet the income requirement. And if we want to be creative and we want to be trying to solve a problem, we could, and again, if it's 5 or 10 people, but that's money that we could use. So if you could talk to Step about that, and I would appreciate that.
And my only concern there is the fact that they are in a nursing home. There's a reason why they're in a nursing home. To get them out into a private apartment or something. I would think that the families, if they do have families, take that into consideration as well.
Yeah.
Totally agree with you.
Yeah, I mean, they're being in a nursing home is not, they're entitled to the same care outside, yeah. So if we can do it, my point is, it might be a way for us to find funds to help the folks.
Yep.
So regarding this program, the payments are limited up to $750 a month.
Correct.
For 6 months, $4,200 max. Landlords would have to accept that as full rent, as reimbursement. And the documentation needs to show at least 30% loss of the income was related to COVID.
Correct.
So there are guidelines and restrictions regarding the monies. Motion accept.
I'll move to approve.
A second?
All in favor, say aye.
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 8.6, Maya Toon, approve amendment to recipient agreement with STEP Incorporated.
Yes, due to COVID-19, the Medical Assistance Transportation Program, which is administered by STEP on behalf of the county, experienced increased costs as a result. So what they are requesting per the state as well is that we modify and renegotiate our single trip rate. Currently, I believe it's at $30.68. They want to make it retroactive back to April 1st due to COVID and revise that trip rate to be $62.43.
Yeah, I spoke to Mr. Plankenhorn, and it had went up due to COVID, the cost, but it's coming back down effective the new fiscal year, which is actually in July.
Correct.
And it will go back down to the normal rate. And they were actually ahead of schedule on their budget.
Right.
So they didn't overspend in their budget, which is another major factor in this.
Yep.
A motion to accept?
So moved.
I'll second.
All in favor, say aye.
Aye.
Aye. Carried. Thank you, Maya. Have a good day.
Yeah, you too. Thank you.
8.7, Jason Yorks is on the line.
Good morning, Commissioners.
Morning, Jason.
Commissioners, seeking your approval for the purchase of a new hay baler from Rovendale Ag Barn, the amount of $27,194.75. We currently have roughly about 50 acres. The acreage that we bale does change back and forth depending on if we have soil jobs, if we take soil in on some of our fields, or if they haven't finished off and we're able to make hay. So right now we're currently around 50 acres. I took Commissioner Macer's question seriously. I looked into the possibility of renting a baler. There is opportunity to rent a baler. It's just the fact that there's no guarantees a baler would be available. The truth is, when we're able to make hay, so is everybody else. So there is a set of uncertainty to that, but it is an opportunity. But quite frankly, we do have the capital funds to purchase this. This is nothing coming out of taxpayer money. This is all out of RMS revenues that we do set aside for equipment every year. So I'm seeking your approval.
And Mr. Yorks, I want to thank you. After I asked you to, I was at the Conservation District meeting, and we learned that the farmer has a baler, but unfortunately it's a square baler, and you need a round baler.
Yes, sir.
Yeah, but thanks for checking that.
Any further discussion? Motion to accept.
I'll move to accept. Approve.
I'll second.
All fair side? Aye.
Aye.
8.8, John Lavelle.
Thank you, Jason.
Sorry. Approve change order number 3, HRI.
Morning, John.
Good morning, Commissioners. So basically, this is a change order that represents a change in quantities. We've actually gone down a little bit in, I believe it was something to do with grading and topsoil requirements, and gone up a little bit in grass, although it worked out that we saved about $2,500 over the total project cost. And now the project is complete. The other part of this is that there was a time extension put in place because of COVID, obviously. So we had to delay the second half of grading and seeding until we were able to get back to it.
Any discussion? Hearing none, I have a motion to accept.
Move. Approve.
I'll second.
All fair side? Aye. Thank you, John.
8.9, Ed Robbins, approve agreement with Center County Services.
Morning, Ed.
Morning, Commissioners. Seeking your approval on a renewal of a contract with the aforementioned program. These folks provide group home, transitional living, and shelter care services for us. They're down in State College. We last had a contract with them in 2013, 2014. They had a few things to do better, to fix. They closed one program. They've been open for a couple years. We have a need right now for this program in this particular area. We actually have a young lady there who is returning from a secure facility and actually doing really, really well. And this program was one that we referred her to that would accept her. She's working. She's already graduated while she was in care with us, but she's working and probably will leave that program soon. That'll be a court order though, but she'll be in that area, living as a 18, 19-year-old young person working. We just need that transition until that happens.
Okay, good. Any discussion? Hearing none, can I have a motion to accept?
I'll move to accept.
I'll second.
All fair side? Aye.
Aye.
Mr. Robbins, is this your last official act with us?
I think so, Commissioner. I don't think we have anything in the pipeline. You might see me on the 9th, hopefully. That'll be my last time in front of you.
When is that?
July 9th?
Oh, July 9th,
July 9th.
okay, okay.
Yeah, I hear there's something in the works to
Really?
maybe talk about my retirement.
Okay.
So I'll be here on that day.
Well, we will wish you well.
I plan on stopping to see you before that.
Okay.
I stopped and saw the other commissioners briefly last week. So
Oh,
I
great.
want to spend a couple moments with you as well.
That would be great. Thank you.
You know, Ed, I've been here for 9 years. Obviously, you a colleague of his,
Yeah, we started at the same time, 1986.
1986. And there's one observation that I've made from your leadership is that comparing our probation office, juvenile probation, to others, we always seem to have the best placements, fewest, and your organization just ran very smooth because of your leadership. Again, it's a testimony to the quality of people that we have leading this county, and no different, but we appreciate you.
Well, as I told you last week, I thank you so much for those kind words. And, sure, mention that about myself, but, we have staff in the office that make all of this happen. And we have the support of the courts as well, and the support of, not only you three, but your predecessors, within boards of commissioners as well. And I just can't thank you, enough for, what you've done for us through the years. And we haven't always agreed. You've said no a few times, but, when I come before you, we've done our due diligence. We've looked at these programs. We've spent time there. We've talked to other programs or other agencies, I should say, that use them. And I come before you with a need and with a really solid reason that they're going to provide some real quality service, and that's what happens. Stuff we do in the community, it's all based on hard work and the research that's out there and the training we've received from the state and locally too. So happy to do it. I love working with at-risk kids and families, and my career's about up though. So
Yeah.
it's time to
Ready for your second career?
Yeah, absolutely,
Yeah.
Commissioner. So, but it's
Young enough.
It's been a few trying days from time to time, but for the most part, it's very, very rewarding, and I look forward. Even this morning, getting up, coming to work. Tuesdays are always my busy day, but I'd love to be in here. Appreciate that.
I saw it apply for the adult probation.
Go back and work.
No, sir, I did
Yeah.
not.
You know, what's interesting is when I was over at Adult, we had researched the average length of a PO and nationally was 4.2 years.
Yeah.
And you look at that compared to our county with our adult and juvenile, we have, 20, 25, 30 years of experience. And when we researched that back then and saw that it was that low at that time, and I don't know if it's changed much now, but at that point nationally it was NFL lineman's 3.2 years.
Sure.
So
Yeah, it's
you look at a PO and what and there's every aspect has every job that the things you don't want to do but you think of some of the stuff that the PO has to do, from conducting your analysis to stand there and watch somebody the handling that, and there's a lot of aspects of the job that aren't pleasant, and the physical part, the danger part, it's very similar. It's a branch of law enforcement, corrections and law enforcement. Whether they're going to go home at night, and it's a dangerous society. We see what's going on with police and law enforcement today, and
it's a great luxury that we've had. I'm retiring in a couple weeks. I imagine that next year we'll have a couple staff retire who have been there, goodness, 30 some years and pushing 30 as well. That's a testament to to our salaries, our benefits, and certainly our work that we do. They've stayed there that long.
Yeah, it is. We have good departments on both ends. So thank you.
Agreed. Thank you so much.
Yep.
All right, 8.10, Shannon Rossman, approve amendment to zoning ordinance 2020-01, hunting preserve use.
Morning, Shannon.
Good morning, Commissioners. Before you for consideration is the hunting preserve amendment that we've discussed at a number of meetings. And as per the last request, we have re-advertised it for the Thursday meeting for you to make a final decision. The advertisement is for the definition of a hunting preserve use in our zoning ordinance, partnership zoning ordinance, to establish supplemental controls for the hunting preserve use and amend the table of uses to add section 3120B to add the hunting preserve use as a special exception only. This would be by a special exception in the resource protection district, the countryside district, and the agricultural zoning districts, providing for the hunting preserve use. We also have the supplemental controls, which include minimum lot size, minimum fencing requirements, and as per the commissioners, we did add the additional if they can use a different kind of fencing as rather than the two that are suggested, and they can prove that it is the same equivalent method, then the zoning hearing board would be able to approve that. We also have the requirement of the plot plan, which will identify any facilities or structures or agricultural uses within a 1,000-foot distance of the proposed use. And everything will be up to the zoning hearing board then to make sure that their safety measures are in place to protect the surrounding landowners. Do you have any questions? I think we've gone over most everything.
So the only question I have is, if you remember the meeting we had at night with the planning commission, one of the members asked us specifically about adding the words and/or.
We did look at that and we discussed it with Mike.
Okay, because it's under supplemental controls, section 2B.
Basically, when we looked at it, it means the same thing.
Okay,
So they do not, what they need to do is, if they have a different type of fencing method,
Uh-huh.
they have to prove to the zoning hearing board that it's an equivalent method.
all right, so will you be sure to communicate that to the member, you know, the specific individual on the planning
Yes.
commission? Because I don't want him to think that we had the meeting, he made his
Yeah.
input, and then we basically didn't even put it into the document.
Well, we added the equivalent method.
Okay.
And then we discussed whether or not it should be and/or, and this is the
Mike, the
terminology.
solicitor, said you can leave it as or.
Yeah.
Okay,
Yes.
so long as that planning commission
Yeah,
member knows.
we've already talked with Mike about that.
Okay.
Yes.
I'm not concerned about Mike as much as I'm concerned about the planning commission
Yes,
member.
no,
who-
yeah.
Just so it's passed on to him.
Yeah.
If he's aware of it, it
Yeah.
doesn't affect, terminology doesn't affect it.
Right.
Yeah, this gives the proposed applicant the ability to provide a different fencing method if it is equivalent. And the zoning hearing board determines equivalent. Okay? Yes, sir.
Put it on.
Thursday, yeah.
But unrelated, but put you on the spot. Old Lake Cumming, permit,
Old Cumming Township?
Old Lake Cumming Township.
Okay.
No one can get a permit there right now because they don't have any. And I
Yeah.
wondered if we could make an exception or something. I know they're not in our.
They're not in our part, they have their own zoning ordinance.
Well, they do, but they're confused as to what to do. And can we give them guidance, or can we?
We can,
help them out?
we can reach out to them and see if we can help them with something or help them guide through I know that they're in transition with their zoning officer and stuff right now.
Would you please call?
Yes.
Dave Shern or the appropriate supervisor? And help us out here.
Sure.
Okay. And let me know, guys.
Yeah. Yeah, we will reach out to them and see if we can give them some guidance. We
Thank
can't issue permits for them unless they were to designate us as the zoning officer, but we could at least maybe help them through the process.
Can they temporarily designate?
I
or
don't
is
know.
there-
We'll have to talk to Mike about that. I'm not sure how that can work out, but we can definitely give them a call and see if we can't help
Okay.
them.
Thank you very much.
No problem. Thursday.
Thank you.
So commissioner comment.
Commissioner?
Yeah, some people have asked me how come we're not wearing masks, and was there an official vote? There was no vote of the Board of Commissioners per se. I think we should wear masks because I think that the governor, at this point, I think is still asking businesses to wear masks. Some employees have asked me about it because they're concerned. So it's something that we may want to do so that we can basically emulate the behavior that we're asking people to do in the community. We may not agree with the state's view on it, but if that's what is being asked and it's not a burden, primarily because wearing the mask protects the vulnerable, doesn't necessarily protect me. It's my way of saying I acknowledge someone out there may be vulnerable and I'm going to respect them. But after watching on the news a lot of healthcare workers really under stress, I realize that wearing masks protects them also. Because every time we have someone who has to go into the hospital for COVID-19, we put those healthcare workers at risk, and they are under a tremendous amount of stress. So I I asked my colleagues to consider that. And I guess in the scheme of what we do in life, it's not that big a deal to wear a mask.
For the public's information, we have a planning cell coordination team that meets on Tuesdays and Thursdays. They have vetted this, researched it, and as of yesterday, the decision was that the mask would be optional in county buildings. So that's where we're at this point. So again, it wasn't a commissioner's decision. They asked us for our input. I had said I feel masks should be optional at this point. That was my belief. It wasn't our decision, it was our input. We have very low risk numbers in this county right now. We have 24 cases in the last 35 days. We stand at 173 cases, and the state has it 78% recovery rate, with I believe 500, and last I know, 563,000 negative tests. Statewide, our local is about 3,350 approximately in negative tests. But to have 173 cases over a 13-week time frame speaks volumes to the residents of our county that they took this serious and did what they needed to do. And I believe at this point, with the low risk, most people have chosen not to wear them. And so that was my view, and I expressed that to the planning cell coordination team, and they're the ones that made the call. And as of yesterday, we put the signs up that masks were optional. Again, it comes down to protecting. I've been saying this for 2 months. We should be protecting the vulnerable. The resources, everything should be for the vulnerable, and we need to get back to living. Yes.
And they do track the properties where the positive cases are at. We have, what, 14 or 13? So
14 active.
Put it in perspective. We have 55,000 parcels. We have 14 active sites. Okay, so now, does that mean we let our guard down? No. I trust that my colleagues, and we don't know, you could be asymptomatic, I don't know. But I trust that my colleagues wouldn't put anybody in jeopardy, or myself into jeopardy, or them into jeopardy, if I felt like I was experienced those signs. I'll be the first to admit that if we start to see those numbers go up in a more drastic way, then obviously we have to talk about wearing masks. But you have to understand this. The science tells you that it's not an airborne virus. So you can't get it by breathing on somebody. You can get it if there's droplets. They sneeze on you, cough on you. Okay, so that's the precautions that we take. So if you're in a restaurant or any place else where you're going to have close contact, then by all means, we can be using the mask.
I'm sorry, you just said it's not airborne, is that correct?
It's not an airborne
Okay, so
virus.
if it's not airborne and I sneeze and those droplets are
That's
in the air.
droplets. That's
Okay, but
different.
how is it, if it's not shared by airborne, how is it shared?
Well, that's the experts.
Well, no, I'm asking for you though, you're saying it's not shared airborne, how is it shared then?
By the droplets. of
Okay,
your-
and how do I get those droplets into me?
Well-
Through the air, it is an airborne transmitted
Well,
disease.
there's airborne
You either
diseases
have
that
airborne
don't
or-
just vapor is is the
Right,
issue.
but I have to breathe it in, those droplets, correct?
That's
Okay,
correct.
so therefore it is airborne. So you saying that it's not
Now,
transmitted by airborne, that's not
That
accurate.
doesn't come from
It's
me.
not vector,
That's-
it is airborne.
No, it's been on TV.
That doesn't come from.
One thing that has not been talked about, that was talked about initially, was this virus had a 70-day life cycle. And that seems to have dropped off the map when it comes to the media. They love to put the deaths up on the TV. They love to put the infection cases up on TV. But they don't talk about the recovery rate. Until recently, we didn't know what it was statewide. Until about a week and a half ago, they started keeping track of that. But we did not throw our signage away regarding masks or mandatory. We kept the signage, and if we have to go back in that direction, we can explore that. But at this point, this was a decision that was reached by the Plain South Coordination Team, and we're going to honor it. That mask will be optional unless we see a spike or a direction that none of us want. But again, we want to commend everybody for being responsible. I've been out to several businesses, restaurants. I can't commend the restaurants enough from the extra precautions they're taking. The businesses that what they need to do, and it's a cost to them. But
I'm out of business.
Yep, I commend them. But we cannot continue to operate at 50%. No business can operate at 50%. So this cannot continue into the fall. It cannot continue to the election. It has to be addressed sooner than later, or things are going to get worse economically with people who can't afford their rents because they're not working, people who can't afford their mortgages. Everybody talks about the virus itself and how it's affecting us health-wise. What they fail to recognize is the abuse that's going on, the addiction that's going on, the suicide rate that's going on, the economic impact that's going on. All those factors are going to outweigh far more people than the virus did itself. And it's all casualties. They're all casualties.
Mr. Coroner. Yes. Can you tell us how many people have been tested in Lycoming County? Do you know?
Because
how many tests?
That's on the website. I think yesterday was 3,353.
I was going to say around 3,000, something like that, I believe.
Yeah.
So the part of the problem is with with saying that there are 14 parcels. Only 3,000 people have been tested, and out of 116 or 113,000 population. What I find amazing is that, and I've said this before, one of the medical directors, actually at Manor Care, held a press conference and said that 50 to 70% of his patients and employees were positive and showed no symptoms. They were asymptomatic, and he was
deadly this is.
and he was astonished as a medical director. He was saying, like, my gosh, here we had folks walking around, and so I think that's the point that I'm trying to communicate in terms of the masks and what employees and members of the public were saying to me, is they're saying that you may have it and you may survive it, but grandma may not, or someone doesn't even have to be old, someone who's got a compromised immune system, people with HIV, people diabetes.
Right.
People, actually list for us some of the people with, some of the compromised immune systems you might have. Severe asthma.
Right.
Right.
And I've been looking at, I have all of the information about every one of the deaths that occurred in the county, and looking at the comorbidities, their hypertension, their lung disease, their lung cancer, their diabetes, all of those things. These people are not just dying from just COVID-19. And I would venture to say that out of the 5,000 some odd people that died in the state, if we actually autopsied all of those folks, I'll bet a lot of those, they died with COVID-19, not necessarily because of COVID-19. Many of these people, unfortunately, that live in nursing homes, live every day on a tight wire. And it just takes any kind of significant illness to throw them off that wire. And I think that's what we're seeing across the state and across the country in these nursing homes, they have so many comorbidity issues, they don't have the ability to combat this virus. And consequently, they die. There are young people that have died. As you know, a nurse, an EMT, a paramedic, there's all those people that are being exposed, and there's a few of those folks that unfortunately succumb to this. But it's not something that, looking at all the deaths that we've seen, it's been clearly the elderly folks with a lot of these comorbidity factors.
And I think obviously in my mind at least, the comorbidity doesn't mean that we don't fight to keep them alive, because correct. Lord knows if we believe in the right to life, we believe in the right to life for people who are sick. That's why. So I think you know, I don't think any of us wants to be in this position with the pandemic. I mean, it's not like it's some conspiracy to try to inflict this. And I think it's important, you know, when you say, Mr. Chairman, that, you know, it can't go till November. I mean, heck, we could have a resurgence in the fall. Let's hope we don't, but there's no question we could have a resurgence and we could have kids going back to school.
Public comment this time?
I'd just like to know.
Tim, could you come up to?
Yeah, sure.
Thank you. State your name for the record. Thank you.
Tim Bauer. I just want to know when it became your responsibility to keep me safe. Why isn't it my responsibility to keep myself safe? If I want to be safe, I'll stay home, wear a mask, whatever. Why do we count on everybody else to keep me safe? I think it should be the individual's responsibility to keep themselves safe. And if you're not worried about catching it, then you go out without a mask.
See, that's what I was trying to explain to you. It's not you not keeping you safe. It's that you might spread it to somebody you don't know you have it, and you might spread it to someone who has a compromised immune system. That's the thing. It's not. We're not trying to regulate.
My question is, though, that person with a compromised immune system should be wearing the mask.
And they are.
Okay. Why do I have to wear the mask then?
Because unfortunately, even people wearing masks can still get it, but by not wearing a mask, there's a greater chance you may spread it. You may sneeze and droplets may go onto a surface. You may. I was watching a gentleman yesterday spitting as he was smoking a cigar, and you know, it's just about whether we're gonna try to be, you know, considerate of our fellow human beings.
I'm just saying, I think that the person who's at risk is responsible for their safety.
Yes, they are. I agree with you on that.
Any other public comment at this time? Thank you, Mr. Bauer.
Karen Koch, still living in Lewis Township, still a resident of Lycoming County. I would like to share with members of the commission today a proclamation for the 30th anniversary of the Americans with Disabilities Act. Whereas approximately 57 million Americans have a disability, and whereas on July 26, 1990, President Bush signed the Americans with Disability Act. Whereas the Americans with Disability Act is the most comprehensive civil rights law in the history for people with disabilities. Whereas the Americans with Disability Act reaffirmed the ideas that all people are entitled to participate fully in our economy, our democracy, have something to contribute, and deserve every chance to achieve their full potential. And whereas the Americans with Disabilities Act promises fairness, accommodation, and participation in all aspects of American life, and whereas each individual deserves respect, access, equal opportunity, and employment, whereas the County of Lycoming is enriched by the diversity and accomplishments of Americans with disabilities, whereas the unemployment rate for people with disabilities is still far higher than those of people without disabilities, whereas we recognize that our work to uphold the spirit and the letter of the law is not yet finished. Therefore, be it resolved that the County of Lycoming salute everyone whose efforts contributed to the enactment of the Americans with Disability Act, and be it further resolved that Lycoming County commits itself to compliance with and furthering the principles of the Americans with Disability Act. And be it further resolved that the 30th anniversary of the signing of the Americans with Disability Act be acknowledged and celebrated by the County of Lycoming and its citizens with the ringing of bells at 7 p.m. on June 26, 2020. We are proposing this to the county as a way to recognize 30 years of civil rights, of equality for all persons with a disability. And I just want to throw out there that disability doesn't discriminate. Any one of us, God forbid, could have a stroke right now, walk out the door, get hit by a car, and any one of you could be invited to join that group of people. So again, I ask that the county consider recognizing this and that it be recognized on the 26th of July to celebrate 30 years of rights for people with disabilities.
Thank you.
May I give a copy of this to someone?
Yeah, if you give it, and if you could email it to Eileen, we will put it together and see if we can get signatures to celebrate that. And
An email copy, Eileen, or handwritten acceptance?
email to Eileen.
Just email?
Oh, July, I thought it was June.
No,
July.
July,
Yeah.
okay.
July
got it.
26th is the anniversary. It was actually signed at 10 a.m., but at 10 a.m. on a Sunday, I don't know that the bells would be differentiated from churches or something of that nature.
Okay, thank you. Any other public comment at this time? Hearing none, our next commissioners' meeting will be on Thursday, June 25th at 10 a.m. Thank you.
Mary Jo may want a Unimart, but I'd rather you give us.
Okay, we'll make sure we do that.
Thursday, yeah, it'll be the hunting preserve, so, okay. What's that?
You need a lockup or somebody else take care of that?
Oh, you can usually, well, yeah.
The deputy takes care of that?
Usually, the last person.
Okay, well, I'll tell you what, I'll leave it.
Girl sitting there, gonna get grabbed down.
15. Okay, it's just concluded.
Okay. Okay, all right, great, I'll leave it.